Okay, we're going to look at CPR, cardiopulmonary resuscitation now. This is what everybody recognises. It's been advertised a lot. Vinnie Jones and various other people. So we're going to look at that process. Now, we only do CPR on a casualty that is not breathing or is not breathing normally, or we suspect that they're not breathing, okay? So I'm going to incorporate the primary survey on my casualty, which on this occasion is a mannequin. Now, I'm the only person that's touching this mannequin, so I don't need to worry, and it's been deep cleaned, so I'm happy and I'm perfectly safe doing this, okay, in relation to COVID-19 regulations. So again, I'm assessing the scene for danger. I've got my gloves on. Hello, first aider, can I help you? Hello, first aider, can I help you? Open your eyes for me. Open your eyes. Okay, I've got no responsive casualty. Don't bring it over yet. Cara, can you just, I need some help. Can you just stay there for a second? I'll just do some checks on my casualty. Just stay there for a second. Going to check in the mouth for any obstructions. I'm listening for gurgling or snoring, which is an indicator of obstruction. Opening the airway, maintaining the airway. I'm now checking for breathing. I'm using COVID regulations here, so I'm not putting my ear next to the casualty's mouth. So I'm looking down the chest. I'm checking for up to 10 seconds for any signs of breathing. Okay, the casualty is not breathing, so I'm going to go straight into CPR. Now, before I do that, because it's COVID, suspected COVID times, I'm going to cover the mouth and the nose with a t-shirt or a bit of cloth and commence CPR. Okay, Cara, I need to call an ambulance. I've got a male aged about 40 years old who is not breathing. I repeat, is not breathing. On the way back, having given their exact location where I am, I need to grab the defibrillator, which is in the kitchen, and a first aid kit and come back as soon as you can, okay? I'm going to do roughly what I think is 30 compressions. Not dumping it in yet. Yeah, that's it, that's good. Just pop that there. Because the defib is here, I'm going to stop doing this now. Do you know how to use this, Cara? You don't? Okay. Right, so I'm going to lift the lid off and I'm going to switch it on.
Unit okay.
Pads come out.
Check responsiveness. Call for help. Open airway. Check breathing. Attach defib pads to pit. Don't touch patient.
Okay, stand clear.
Don't touch patient.
Everybody stand clear.
Shock advised. Don't touch patient. Press flashing shock button.
Okay, stand clear, everybody. Stand clear.
Shock delivered.
Okay, no signs of recovery. So I'm going to commence CPR. I'm going to carry on. I don't need to do rescue breaths because I suspect this person might have COVID. And I would carry on. Just going to stop that machine. Obviously, in this scenario, if it was a real life scenario, I'd obviously have a mask on, but just for training purposes, I've taken the mask off because this is a mannequin. But in a real life situation, if this is a real person and I suspected COVID, I would be wearing a mask. Their mouth and nose would be covered. I would not be undertaking any rescue breaths on this casualty, okay? I'd be doing chest compression only. So where this defibrillator gives me a metronome 30 count, you don't have to stop when you get the little gap, just keep pressing on the chest. So it's just chest compression only, CPR. Listen to the machine throughout. So what I'm going to do is I'm going to stop there now. I'm going to take the defib off the person. I'm going to break this down into CPR and then how you apply the defib, okay? Okay, so what I'm going to do now is I'm going to go break that all down, starting off with CPR. So what I'm going to do is I'm going to demonstrate full CPR with rescue breaths. This is pre-COVID, and at the moment, they recommend that you don't use rescue breaths on an adult. Slightly different for babies and children. They do recommend rescue breaths because it's an important part of CPR on a child and a baby. But I'll cover that when I cover pediatrics, okay? So with an adult, I've assessed my casualty, they are not breathing. So I'm therefore going to commence CPR. So with my checks, I'll go through that. Checking for breathing for 10 seconds. And as soon as I've established they're not breathing, I've got my bystander on standby there. I go straight into chest compressions, okay? From here, heel of the hand, your strong hand in the middle of the chest. So there's the chest, middle of the chest. You've got a natural indentation on your chest. Place the heel of the hand in the middle of the chest, interlock the fingers to pull the fingers away from the rest of the chest. Shoulders above the casualty, arms locked, and you rock backwards and forwards, and you're aiming to push down roughly 5 to 6 centimeters. Okay, so I'll demonstrate that. And it's a nice rhythmic rocking backwards and forwards. None of this jerkiness, it's just a rocking backwards and forwards. My knees are a little bit away from the casualty. The shoulders, very importantly, are right above the casualty's chest. So it means I'm not, and my back is nice and straight, because you might be doing this for some time. So I'm pumping on the chest, and I'm doing roughly 30 compressions for my first set. And the reason I say roughly is because you're going to be giving instructions to your bystander on getting the ambulance, defib and first aid kit. In terms of the rate of compressions, an average adult's pulse rate is about 70 a minute, anything from 70 to 100 a minute. Our target rate of compressions is 100 to 120 beats per minute. So that looks something like this. Okay, now you can have a tune in your head to help you get the right rhythm. There's a couple of them out there. Baby shark, do 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 do, baby shark, do do. That's a very annoying one, and bear in mind this is in your head. You don't sing this out loud. It's not particularly empathetic to families when you're doing CPR on their loved one. Okay, staying alive. Another one, staying alive. So there's lots of tunes you can have in your head that give you the right rhythm to pump on the chest. Once you've done your 30 compressions, you then do rescue breaths. Now there are several things out there that can protect you when you do rescue breaths. Aside from COVID-19, it's not a nice experience putting your mouth against somebody else's mouth because they may have thrown up, they might have blood around their mouth. So these are all ways of contracting infectious diseases. So first one is a face shield. Okay, very straightforward bit of kit. You can get key rings with the face shield in them and put them on your car keys. Very good, not very expensive. Okay, so CPR life keys. Place the face shield over the mouth, like so. So it actually fits on the face like so. The filter is over the casualty's mouth. Pinch the soft part of the nose. You've got to open the airway on the casualty. If you don't open the airway, you will not get air in that casualty because the airway will be blocked. So tilt the head right back, form a seal over the whole mouth and blow. Two rescue breaths. You should spend no longer than 10 seconds doing that. It should only take you about 5 or 6 seconds to deliver your two rescue breaths and then straight back onto the chest. 30 compressions, 28, 29, 30, 2 more rescue breaths. Okay, now the other form of protection is a pocket mask. Now I believe with your defibrillator you've got a pocket mask. Okay, now they look like this when they're collapsed. Put your fingers on the outside of the pocket mask and push on the filter underneath and it will pop out like so. Place the valve on top of there, and as you can see there's an arrow on there pointing to the nose. You place it over the casualty's mouth and nose. Make a diamond shape with your hands, place it over the casualty's face and the mask, pushing down firmly, open the airway and blow. After each inflation, take your mouth off the device or off the face shield, look down the chest to make sure you're getting air into the chest. Now, if for any reason you're not getting air in there, the number one cause for that failing is because you're not opening the airway, and that means tilting the head back. If there is a blockage in the person's airway and you're not getting air in, then just focus on chest compressions, okay? The other reason for taking your mouth off the casualty's mouth from time to time between breaths is because quite often casualties do throw up. And you don't want to have your mouth near their mouth when they're throwing up, okay? So if it does happen, we take that off, we roll the casualty onto the side, clear the fluids, back on the back, carry on. Now this gives you more protection than that. So this is your preferred option. If you start off with that, somebody brings your first aid kit and you've got one of those in there, get them to set that up so you can start using that because it gives you more protection. Obviously with COVID, we don't do rescue breaths on adults. We just place a t-shirt, towel, whatever, over the mouth and the nose. We commence compressions and that's all we do. So we don't even have to count. You just keep doing compressions. Now, let's be honest about it. You're not going to be able to do that for a great length of time before you're going to get tired. So this is where your bystander can come in on the other side of you and help you, okay? Now, if you are doing rescue breaths, when things go back to normal, only the first aider, the initial first aider, does rescue breaths. The bystander does not do rescue breaths. Why? Because there's only one pocket mask and you don't want cross-contamination, okay? So only the first aider does a rescue breath. When you stop to have a break and let your bystander take over, they just do chest compression only CPR. You should aim to swap every 1 to 2 minutes, okay? Right, so that's CPR. Now the only time I stop doing CPR is if I am totally exhausted and I can't carry on. If there's a danger situation, changes. For example, I'm at a roadside doing CPR on someone and I can see fuel coming across the road towards me. If there's danger becomes apparent when I'm doing CPR or the building's on fire, I had to get this person out of the building, then I stop CPR. If they make a significant recovery, now let me tell you, it's a very unlikely occasion where you will bring them back doing CPR when you're doing CPR on a casualty. It's very rare you bring them back doing CPR alone. The game changer is the defibrillator, okay, which I'm going to come on to next. So ideally, swap with your bystander every 1 to 2 minutes. Right, so defibrillator, I'm going to demonstrate the Zoll defib, which you have, okay? So a couple of things with the Zoll defib. As soon as your bystander arrives with it, the first and most important question to ask them is, do you know how to use it? Now, if they're a bumbling wreck and they don't, take it off them and you use it. Now, you could get them to do CPR, i.e. the chest compressions, whilst you're setting the defib up. But it's very important, don't waste time. It's vitally important you get this on them as quickly as possible. So with your Zoll defib, a couple of things. Take the lid off, that comes off. That can go underneath the shoulders, like so, and it naturally opens the area on the casualty, okay? Switch the machine on.
Unit okay.
Now we don't need to wait for the voice prompts.
Check responsiveness.
It takes you through Doctor's ABC. What we're going to do is initiate the pad straight away. Now you have to clear the casualty's chest of any clothing or any other obstructions. That could be chains. I'm just going to turn that off just while I talk about the safety checks. If they've got necklaces on, move them out of the way. If you can't move them out of the way, get your tough cut scissors, cut through them, get them out of the way. If it's a female casualty and they're wearing a bra, cut the bra off, okay? Because it might have an underwire bra on, that could interfere with the defibrillator. If they're lying in a pool of water, get them out of the water. If it's outside and it's just a light rain, not a problem. But if it's torrential rain, you need to get them under cover because you cannot use a defibrillator in those circumstances, okay? The other thing you need to be aware of is bystanders. You need to control the scene and make sure bystanders are well back. Now, for that reason, the defibrillator machine should be on your side of the casualty because you're controlling it and on by the head of the casualty, okay? So once you've established you've got your machine there, take the pads out. Now, the pad placement is very important. The only other thing I wanted to mention about the chest, if they're covered in blood or sweaty, you have got a cloth in your defib kit to wipe down the chest of any fluids, okay? If they've got piercings on, a basic nipple piercing is not going to cause a problem for a defibrillator. If they've got a chain connecting the nipples, then you need to cut that off, not the nipples, the chain, okay? Again, because that will transmit electricity that will interfere with the use of the defibrillator. Now, your defib has got this configuration of pads, okay? It's like a Z pad. And in the middle of it, there's this little puck, and these are actual pads. This little puck which will tell you if you're pushing hard enough on the casualty's chest. Now, the way this works is you pull these pads, these things off, and stick the first one up here, as demonstrated on the actual picture, up there. That sits in the middle of the chest. Then you take this one off, And that goes there. Once that's on there, what will happen,
Unit okay.
it will start telling you,
Stay calm.
analyzing heart rhythm.
Call for help. Open airway. Don't touch patient.
Okay, here we go. Analyzing, that means the pads are in the correct position.
Don't touch.
Okay, stand clear everybody. So I'm emphasizing what the machine's telling us.
Shock advised.
Okay, so I'm going to be pressing that button.
Press flashing shock button.
On the defib, there's the button, we press that, but before I press that, I need to make sure everybody is well away from the casualty.
Shock button.
Stand clear, shocking,
Shock delivered.
I then go straight back onto CPR, and here we go. In time with the metronome on the machine, and it'll give me 30 beats. Face mask on. And I carry on. Now, eventually that machine will give me another prompt in about 2 minutes time, okay? I'm gonna switch that off and it'll say stand clear, analyzing heart rhythm. Just make sure you're listening to the machine at all times. Now, if the ambulance service eventually turn up, don't stop doing CPR until they tell you to physically stop. The reason being is they've got all their equipment to get out the ambulance, and it's very important. They will probably, if they see you doing effective CPR, they'll say, just keep doing what you're doing. Information that would be useful to them when they arrive, if they see a defib there, how many times is the defib shocked? Okay, so that's important information to note for the ambulance crew when they arrive. It's shocked twice, okay? Because that's really important information for them. That gives them an idea of how long they've got, what drugs they might need to use on the casualty. So it's shocked twice. If it has any stage, the actual defib says no shock advised, there's two reasons for that. It's not a shockable rhythm or they've made a significant recovery. Now, if they've made a significant recovery, you'll see it. Their colour will return to their face because the heart's pumping blood, which brings the colour back to their face. They may well start coughing, the eyes will start going, they might start swallowing. You will see the signs of a significant recovery. And unless you see that, you just keep doing CPR. Now, at some occasions, people have physically died. You've used the defib and it says no shock advised. What do? We just keep going because we're not qualified to make that call that they are dead. That's down to paramedics, specially trained, advanced trained medics to actually make the decision, right, we're gonna stop now, okay? Hello, first aider, can I help you? Assessing for danger. I can't see what's happened here, there's no danger. Hello, first aider, can I help you? Hello? You open your eyes for me, please. Open your eyes. Okay, can I have some help? Carl, can you just stay there for a second while I just do some checks on this casualty? Checking in the mouth, open the airway, assessing for breathing for 10 seconds. Okay, not breathing, right. Tara, I need you to call an ambulance for me. I've got a male aged about 40 years old and they are not breathing. I repeat, they're not breathing. What I need you to do is grab the defib on the way back with the first aid kit. Make sure you've given our exact location to the ambulance crew and come back as soon as you can. Do you understand? Okay, do you know how to use that? Okay, fantastic. I'm going to stop there, fantastic.
Unit okay. Stay calm. Check responsiveness. Call for help. Open airway. Check breathing. Don't touch. Analysis halted. Don't touch patient.
Okay,
Analyze.
stand clear.
Don't touch patient. Analyze it.
Stand clear.
Shock advised.
Okay, everybody stand clear.
Don't touch patient. Press flashing shock button.
Okay, I'm going to be shocking. Stand clear.
Shock delivered. Start CPR.
Did the ambulance say how long they were going to be, Tara? Okay, fantastic. And I would keep going until I'm told to stop.